Hi, I'm Russel McKenna with YADAYADA. How do you know if your child has pneumonia? And what should you do if they do have pneumonia? Children often don't just have pneumonia. Pneumonia is often the leftovers of a cold and the consequences of maybe two things: worsening lung function and loss of protective barriers. So with worsening lung function, think about, for example, wheezing. That's when your child is working harder to blow air out. And with loss of protective barriers, think aspiration risk. One common thing that we see with children or infants that have bronchiolitis from RSV is a good number of them do aspirate and get an aspiration pneumonia. With that being said, pneumonia presents slightly different in certain ages. These ages include newborns, which are less than 1 month olds. And then it includes infants, which are greater than 1 month up to 1 year. And then the next group is toddlers or preschoolers. And then the final group is older children or adolescents. Now, newborns with pneumonia rarely cough. More often, they have poor feeding. They are extra fussy. They breathe really fast, or they're tachypnic. They get retractions. That would be a sign that they're working harder. Or they start grunting, and that's making noise when exhaling. And then the last thing is they have low oxygen or they're hypoxic, and that would be they look pale. Of special note with grunting, grunting in a newborn suggests that something is wrong with their lower respiratory tract. And so that's a very ominous sign for a newborn. After the first month of life, cough is the most common presenting symptom of pneumonia. But cough alone does not mean they have pneumonia, so there's other things to factor in there. Infants usually have a history of recent upper respiratory illnesses, and then they develop other common symptoms, which would include breathing faster, or that tachypnea, retractions, that would be the working harder to breathe by using extra muscles, hypoxia, that would be pale color and fatigue, but they also might grunt. That's less common the older an infant gets, but these signs and symptoms are usually accompanied by a persistent cough, congestion, fever, irritability, and decreased feeding. Infants with a bacterial pneumonia, they often do have a fever, but those with a viral pneumonia often don't. Or if they have a pneumonia from an atypical organism, they may not have a fever. Parents, they may mention that the child is wheezing or has noisy breathing as well in this age group. Toddlers and preschoolers, they most often present with fever, cough. That cough, it can be productive or non-productive. They often are breathing faster, so that tachypnea again. They usually have congestion because it's usually part of a cold. They may have some vomiting, but that vomiting's not, hey, I've got diarrhea and vomiting. That's going to be, hey, I'm coughing, I'm choking and gagging on my mucus, and I'm vomiting because of that. They may have a history of, as I talked about earlier, they may have a history of an upper respiratory tract illness, which tends to be very common. So the last group is the older children and adolescents. They may also present with fever, a productive or non-productive cough, congestion, but then they get into things like chest pain. They may not be eating or drinking, so they get dehydrated. And then because they're not eating or drinking, they become lethargic or tired. So in addition to the symptoms reported in the older children, adolescents may have other constitutional symptoms such as headache, chest pain with breathing, even vague abdominal pain. Vomiting, diarrhea, a sore throat or pharyngitis, ear pain, those are other common symptoms. So if your child fits this picture, consider calling a qualified medical practitioner and getting your little one looked at. Be safe, and thanks for listening.